My name is Dr. Byron Falwell, and I'm here talking about effective treatments for significant spinal problems, pain, and discomfort radiating into the legs. As mentioned, this was a 53-year-old gentleman with radiating pain into his right thigh, originating from a particular area of the spine that's considered more of the mid-upper spine. This is L3 and this is L4. This is the bone structure. There's some bony spurs growing across the front to orient yourself. This is the front, the abdominal area, and this is the backside here. And here's the pelvis in this particular region here. Now you can see the nice wide opening here between the second and the third vertebra and the nice opening. And you can also see it in the level above fairly well between the first and second vertebra. The symptoms of this gentleman is coming from the narrowing now developing from the degeneration. You can see the narrowing between the two bones here. These are called the emplates or sclerosis. You can see the whitening, a thickening of bone. It's time to buttress this particular area from closing down on top of each other, but it's becoming a rather advanced case at this point. So you can see the wear and tear process is pronounced. Now, this gentleman had surgery in 1988 to the lowest level, which is down here out of view from this particular study. We're going to move on to a same view, but of a lateral view of an MRI, which now demonstrates fills in the blanks. You can now see the disc and the nucleus of the disc here in the fluid, but it's starting to thin out rather quickly. Still pretty nice up in this area. This is the L3-4. This is the 4th, 5th vertebra, where you commonly see the traditional sciatic pain, which is down the back of the leg, as would be in this level too. But in the mid-upper lower back, you're going to see symptoms associated more with thigh pain, affecting what is commonly referred to as the femoral nerve that comes out into the leg coming through the groin. Now, this gentleman also has a disc bulge in the front of this particular disc. This one looks like it's bulging, but this is more fluid, maybe a blood vessel of some type. But you also see wear and tear on the backside that's happening. Again, I mentioned this is the 3rd and 4th, the 4th and 5th, and the 5th and S1. He had prior surgery in this area, and it's done relatively well with this. But now forces are transferred up here, so he's trying to avoid a second surgery and seeking care through a chiropractor. He'd been to 2 other chiropractors, had side posture adjustments, the type which you lie up on your side, and you'll see a person twisted up. This is a particular view from this, again, is the front of the vertebra. This has been sliced down, looking down on top of this particular bulging disc. There's a little bit of wear and tear and disc inflammation along the surface of the left side of the patient's right. This would be the right. The inverse coming up from underneath on this particular MRI is now narrowing where the nerve would be coming through here. Now it's completely obliterated. The use of the Cox therapy, unlike the side posture, we can allow treatment to draw this back into the center and take the pressure off. Might take upwards of a month or two's treatment to effectively reverse this, but we can perhaps help this gentleman from having to go through a second procedure, surgery, which would most likely require cutting the bone structure off the backside of the vertebra and then have to have bolts and screws placed in. And, I'm just sorry to see this happen so often in our area when they have such an effective, powerful treatment called the Cox therapy. So give us a call if you've been told you need back surgery so we can aid and help you give a real choice in making a difference, perhaps in avoiding a surgical procedure. Thanks for watching.